Which STI symptoms should you worry about? Imagine noticing something unusual in your body and wondering if it's something to be concerned about. Recognizing the signs of sexually transmitted infections is key to protecting your health and that of your partners. Some symptoms are mild or go unnoticed, but others can be serious and requiring prompt medical attention. Knowing which symptoms to watch for can make a big difference in preventing complications. Many STIs do not cause obvious symptoms, especially early on. This means you could have an infection without realizing it, which increases the risk of passing it to others. However, certain signs should never be ignored. If you experience pain or burning when urinating, or notice unusual discharge from your genitals or rectum, these could be signs of infections like gonorrhea or chlamydia. Sores, blisters, or ulcers on or around your genitals, anus, or mouth are often signs of herpes or syphilis. Unusual bleeding that isn't part of your regular period, especially after sex, can also be a warning sign. Pelvic or abdominal pain, particularly in women, might indicate pelvic inflammatory disease, which is a serious complication of some STIs. If you develop a rash, fever, swollen lymph nodes, or flu-like symptoms shortly after sexual activity, these could be early signs of HIV or syphilis. Itching, irritation, or a strange smell from your genitals might suggest trichomoniasis or bacterial vaginosis. Pain during sex that is new or unexplained can also be a sign that something is wrong. Ignoring these symptoms can lead to long-term health issues. For example, untreated chlamydia or gonorrhea can cause pelvic inflammatory disease, which may result in chronic pain, infertility, or even ectopic pregnancy. Syphilis, if left untreated, can damage vital organs including the heart and brain. HIV, without treatment, can weaken your immune system and lead to AIDS. Some infections like human papillomavirus may not cause symptoms but can lead to cancers later in life. That's why regular screening is so important, especially since many STIs do not show symptoms at all. If you notice any of these signs, it's essential to see a healthcare provider as soon as possible. Early diagnosis and treatment can prevent serious health problems and reduce the chance of passing the infection to others. Even if you feel fine, regular testing is recommended if you are sexually active, particularly if you have new or multiple partners or if your partner has an STI. Diagnosis usually involves a physical exam, a discussion of your sexual history, and laboratory tests. Treatment typically includes antibiotics or antiviral medications, and it's important to complete the full course prescribed by your doctor. Your partners should also be tested and treated if necessary to prevent reinfection. Using condoms consistently and correctly is one of the most effective ways to reduce your risk of many STIs. Vaccines are available for some infections like human papillomavirus and hepatitis B, which can provide added protection. Open and honest communication with your sexual partners about health and testing can help keep everyone safe. Regular checkups and screenings are vital, especially if you're at higher risk or have multiple partners. Remember, paying attention to your body and seeking medical advice when needed is a smart step toward maintaining your sexual health. Many STIs are treatable, especially when caught early. If you're unsure about symptoms or your risk, don't hesitate to consult a healthcare professional. Your health and well-being are worth it, and professional guidance can help you make the best choices for your body.